In January 2020, the world woke up to the news of a devastating pandemic. What started as a fever in Wuhan, China, was later declared a global health emergency by the World Health Organization, the coronavirus. Many countries were unaware and unprepared for what is to come. The hesitancy by the Nigerian government to approach the health crisis with the urgency it deserves saw the first positive case of COVID-19 recorded in Lagos through an Italian citizen who works in Nigeria and had just returned from Milan, Italy, on the 25th of February 2020. It was as if it was being waited for before stringent measures will be taken to address the pandemic. Soon, the world went into a lockdown, rendering many jobless, crumbling economies, exposing weakness of health systems, on the other side, giving a boost to digitalization, but most unfortunately, killing millions. With the discovery of vaccines to deal with the pandemic, countries have relaxed restrictions hitherto imposed to control the spread of the virus, opening economies and gradual recovery and return to normalcy. With the reduced cases of COVID-19 in the country, we hear from the Nigeria Center for Disease Control. Is Nigeria out of the woods yet? And what are the lessons for Nigeria's healthcare system? This is the issue in focus today. Welcome to the program. I am Ayuba Ilya. All right, thank you for joining us. And we have joining us virtually Dr. Yahaya Disu, the Head of Communication, Nigeria Center for Disease Control, to talk about some of the updates as regards Nigeria's fight against COVID-19. Thank you so much for joining us at this hour.
Thank you for having me. Good afternoon.
Let's begin by asking the question whether we are now safe. Going by the numbers that we've seen in recent times, it appears that there's a decline, and then, Nigerians are just moving on. The PTF, have initially said, that there's no need for some of the restrictions that Nigerians have had to hold on to. So, are we safe now?
Yes. First and foremost, I need to clarify that we are not out of the woods yet. Then we have experienced in the last 3 years how COVID-19 surges are coming at interval. So we've been experiencing waves, and this period of the time we're a little bit down. We're experiencing low number of cases, but by our attitude, our behavior, the cases can still go up. And then we have also noticed that when festivities are coming or the time people are traveling, these are the likely time that we will have high number of cases. And then you also agree with me that globally, there are countries who are having cases, sudden cases, like China now, they're experiencing lockdown, while some countries in Europe are not experiencing high number of cases, particularly a drastic reduction in number of deaths because of the vaccination coverage. But in our own climate, our vaccination coverage is still low, even though we are having fewer number of cases. But the risk is still there that once we have surges, the cases can start going up, because we are not using non-pharmaceutical interventions very well, like use of face mask, hand hygiene, and avoidance of mass gathering. We have also thrown all of this to the wind. We have thrown caution to the wind. So we are not yet safe. Even though the cases are low, it doesn't mean the cases cannot still go on. And we encourage Nigerians to make sure that they take the vaccination, they are fully vaccinated, and they wear these face masks when they are indoors, especially when they are in public places where there is likelihood of transmission, like in the malls and the banks, and then so on, in closed setting. But when they are outside, they can use their discretion when the risk of transmission can be very low. So, but then if you are outside and you are where you have crowd, then it is expected that you can use your mask. Or even if you know that you are a vulnerable person, Then, and to protect yourself, because if you suffer the disease, it may severely affect you. So because of that, I advise that you also use your mask. And so what the Presidential Steering Committee has done is to review the protocol in view of the data. Tomorrow, based on the data, they could adjust again and announce to Nigerians what they need to do.
By the current numbers that we have recorded, what are the indications? What is it showing us in the country, in terms of the demographics and, some of the contacts that we have recorded?
Generally across the country now, we're having fewer number of cases. And then the deaths too have dropped significantly. And then when that happens, and when you're having very few cases, it may be difficult to say that, this is the demography that is being affected. And then mostly, again, number of cases we are seeing are among the travelers who are coming into the country. Because in other parts of the country, also a part of the world where they are having cases like Eastern Europe, where you have war ongoing, and they're far away from China, and some other countries that are reporting some of these cases, and we have Nigerians or nationals who are traveling from those countries. So that's why those who are not fully vaccinated are still required to do the testing because they are the ones that are more likely to still carry this virus. So what we are saying now is, because the prevalence is low, and we need to be on the watch, be on the lookout, and then also not to lower the guards, and then make sure that where the risk of transmission is high, like in closed setting or where you have large crowd, large gathering, then we still use our face mask and then maintain this physical distancing where it is possible.
Let's talk about vaccination. That's a target for Nigeria, but apparently the WHO has, lamented the low penetration for vaccination among Nigerians. What exactly are the challenges that we are looking at in that regard?
Then the major challenges we have with the vaccine is with the demand and not the supply. The vaccines are available. Like our sister agency, they always say that the vaccines are available even at the healthcare centers. And then all the options, whether it's Moderna you want or you want Johnson & Johnson, AstraZeneca, they are available. But because vaccine hesitancy that is experienced, and which is not limited to Nigeria alone, and that is what is causing this. And when people feel that they are not at risk of getting this disease, there is likelihood that they feel that there is no need for them to take the vaccine. So issue of confidence and safety in the vaccine, and this has been addressed by government and by evidence of those who have been vaccinated outside Nigeria across the globe, and then to demonstrate that people who take the vaccine are safe, and the vaccine has been proven to be effective in countries that have really met their target. And we can see the drastic reduction in number of deaths, and they have returned back to nearly normal livelihood. So, but we still, because of conspiracy theories, different misconceptions, people are not taking the vaccine. But issue of accessibility has been addressed by ensuring that the nearest primary care centers to us, these vaccines are available. And they even take these vaccines to market locations where people, because of the market activities, they may not have time to go to the primary care centers, and they can get it. So they have some special locations where they make these available. We can only continue to appeal to Nigerians that the only way to get out of this group is to ensure that we all take the vaccine. Once we achieve the high vaccination coverage, it is then we can get the collective benefit of the vaccine.
Say that the relaxation of these restrictions have affected the vaccination process that is ongoing, because globally there seems to be this relaxation of restrictions from different countries. Some do not even require for one to even present the test, the PCR test anymore. So how is this affecting the drive to get more people vaccinated?
Now, it's unfortunate that people misinterpret government gesture, the idea of lifting restriction as that COVID-19 is no longer in existence or we have overcome it. Meanwhile, our government is considering other factors like the impact on economy, our livelihood, and to ensure that there is a balance. As the more they lift the restriction, there are higher chances that we will have more cases. But then we also notice that the more they do that, the more they also understand how to tackle the pandemic. And that's what's informed lifting of restriction. But unfortunately, people misunderstand that as there is no more coronavirus outbreak again. So people think it's time for them to go to their normal activities. People probably are used to enforcement until it is enforced. They don't think it is serious. But government also realized that we need to continue to educate ourselves and engage people where necessary for them to really understand and identify if there are barriers that can prevent them from taking the vaccine or complying with the use of the protocols like a face mask. So I think it's continuous engagement, and everybody has role to play: the media, traditional rulers, the teachers, professionals in banks, in work setting. We need to continue to talk to ourselves until people understand and are able to take the vaccine.
And since the relaxation of these restrictions as regards to taking of the vaccine, before the relaxation of the restrictions, I'm sure you have, more people getting vaccinated. But I'm concerned whether we've seen a decline since that decision was taken.
Yes, exactly. You're right. That's what I was telling you. That people feel once government say that they are relaxing the protocol, it means the condition is no longer serious. But the reverse is the case. And the condition is still serious, but the government is also considering the other aspect of the pandemic, which is the economic effect, in order to make sure that it does not severely affect us economically. And then why you and I, what we need to do is to continue to educate the people like this platform, to let them know that the government gesture should not be misinterpreted as that the virus is over and then that the pandemic is over. Well, and then we also need to do engagement at community level, and especially the actors at the state level, our colleagues at the state level, to make sure that they engage the various stakeholders to explain this to them. And then the earlier we all cooperate together, we're able to fight this virus, the earlier we can all return back to our normal life. So you are right that the hesitancy is increasing because of the relaxation of the restriction. But then the relaxation is as a result of the impact on the economy. But then people need to understand that we should not say because of that we should not take the vaccine. We are still not out of the woods.
Again, these vaccines, they have expiry dates. I mean, they're not going to be on the shelf forever, isn't it? So, and before now, we've seen the destruction of over 1 million doses of these vaccines. So with this hesitancy, is it likely that we may also see more of the vaccines expire?
The federal government, I learned that they reviewed the policy and the process for getting vaccines, and so they themselves understand the issue of hesitancy, so they don't get the vaccine that will expire very soon. So all these have been factored into consideration, and you can see that you've not heard about the issue of vaccine destruction. So the vaccines that they have in stock are the vaccines that still have a long lifespan, and the theory of first in, first out, as in the ones that are close to expiry are the ones that they make sure that they give out as soon as possible. So I don't think that is a big issue with us. But if hesitancy continues, and then of course it may still be a challenge.
Are you concerned that we are likely to see an increase in the numbers of positive cases, even as Nigeria celebrates the Eid al-Fitr, this week?
Yes, the risk is there because as we gather, as we pray, as we socialize, as we travel from different parts of the world, and people come in, some people might be coming in from countries where cases are going up, and the greater worry is the issue of bringing in variants, and which may also cause serious trouble for us. Because if it is circulating variant that our system is already getting used to, but if a new one comes in, it can easily break the barrier that we have already established, and that can be a serious challenge for us. So this is the time for us to be cautious, to ensure that we cautiously celebrate the Eid al-Fitr, and this is the time we need to celebrate responsibly, especially because of the vulnerable ones who probably have not been vaccinated.
Now, let's talk about lessons. I mean, COVID-19 came, I'm sure, with a lot of lessons for both citizens and government alike. So, what are some of the lessons that we have learned, through this period of COVID?
Well, the lessons cut across different sectors: economic sector, health sector, even governance. And governments have been able to understand the importance of trust, and how it is very necessary in a situation like this. And I'm sure our governments have been able to assess themselves and to understand how much people can believe them based on the trust that exists between people and government. Then with regards to economy, we now know that when they say health is wealth, and then if we don't have good health, or we have problem with our health, it can undermine our ability to generate wealth. So it has really affected us. So this is a wake-up call for government to prioritize how to increase budgetary allocation to health, not to solve the immediate problems, to prepare for future problems, to improve capability of our healthcare system, to be able to deliver appropriate state-of-the-art facilities and the healthcare needs to the people. And then in case of future pandemic, we're able to address that. Then the lessons for the healthcare system itself, healthcare workers themselves have also learned from this, and use of virtual, these are ICT in terms of consulting, engaging, and then sharing information, meetings across the globe. I know how many meetings I've participated in through the virtual meetings, and then connecting with the healthcare workers across the globe, sharing lessons, best practices. So, and those things is because of this pandemic. And it has also opened the eyes of our government to the rot in our system. You remember there was a time that nobody can get outside Nigeria to get care for COVID-19. So you have to rely on what you have in your own country. And that has made the authorities to see that they focus on our problems, they learn the problem. I know that they may not be addressing the issue now, but they are aware of the challenges. But it's not left for us to continue to remind them that these problems are here, and then COVID-19 has revealed them. And if we keep quiet, and then everybody will go back to business as usual. And it's only natural that can happen unless we continue to advocate for the community. And then they now are aware that there is need for them to report if there are symptoms. And you may link the number of cholera cases we had last year across over 20 states to awareness in disease reporting, and to know that if they go to health facilities and they may need to be examined and then be able to take some samples. The increase in cholera cases may not necessarily mean we are not having this number of cases before. And it could be that because of awareness now, and people can report. And before, people could say that this is witchcraft, this is strange illness, but now they know that they can diagnose it and get care. So that surveillance, which requires cooperation from both people and the healthcare system, the healthcare workers' ability to suspect and detect this when people report. And then, so we're also seeing that increase too in Lassa fever and then some other diseases. So that's a lot of lessons. Even the HIV, malaria, and TB. And there's been a lot of collaboration between those agencies managing those diseases, and then like NCDC managing infectious diseases, because how COVID-19 has affected them. So that has fostered collaboration among different governmental agencies. And then working with private sector is also another experience that we have also learned during this. I can continue to mention this on and on. The challenges that we have, of course, is because the virus was novel and the diverted attentions that other diseases should have gotten, and the resources that should have been allocated to them towards COVID-19, because nobody knew how the COVID-19 was going to turn out, particularly how it has manifested in the developed countries. But now that we now understand this and the lessons learned from this, we are now extending that to responding to other priority diseases, and then how to make sure that the stakeholders' engagement, collaboration, and that we have already established, and in the system of engaging people communicating, we are using it for other diseases like Lassa fever, cholera, meningitis, and so on and so forth.
All right, now I would like for us to talk about, the capacity of the Nigeria Center for Disease Control, but that will be after this short breather when we come back. Please stay. All right, thank you for staying. If you're just joining, you're watching Issues on Trust Television, and we have joined us virtually Dr. Yahaya Disu, Head of Communication, Nigeria Center for Disease Control, talking to us about Nigeria's fight against COVID-19. Is it Uhuru yet? That's what we are talking about. Now, when you look at an organization like the NCDC, would you say that its capacity to deal with epidemics, such as this, has been improved since, the coming of COVID-19? Because we saw, Nigeria at a point was dealing with three different things: Lassa fever on one hand, cholera on the other hand, and then COVID-19. So in terms of capacity, how has the NCDC improved?
Well, you will agree with me that before COVID-19 pandemic in the country, we have laboratories, about 4 or 5 of them, that can diagnose viral ailments, and then especially COVID-19 in the country. But now we have in all the 36 states of the Federation over 100 laboratories that can confirm this diagnosis. And this is not just for COVID now. We're using it for diagnosing other viral ailments. Like Lassa fever that used to be in Erua alone before, we have some other states now where we can use this to diagnose Lassa fever. So the lesson there is without laboratory, we are not able to confirm diagnosis. And then in recent times, Nigeria has been getting some kind of recognition and award from international communities with regards to our laboratories, like our national reference lab when it was assessed, and it is now 5-star, and then you know what that means, and it's one of the best for the region in this place. So, which means Nigeria can also even provide support to countries around us when it comes to laboratory. Then with regards to the workforce across all levels, we now have workforce who are experienced and in responding to epidemics. Unfortunately, again, Nigeria is also experiencing exodus, as in terms of healthcare workers leaving the country. And then that means that something needs to be done to ensure that we retain these healthcare workers, we retain this experience, so that we will be able to use those experience for managing other epidemics and other diseases in the country. So that's for on the part of the workforce. And then organization of the workforce of the system, because responding to COVID-19 was a massive responsibility. And then so the lessons learned from that, the skills we learned from that, from coordination, and it has always been there for us to leverage for other epidemic diseases. Our Public Health Emergency Operations Center used for coordination. Before COVID-19, we have them in just about 20 among the 36 states of the country, even less than that. But now we have for all the states in the country, and the colleagues at the states level have been built, their capacity have been built adequately. They are able to confront or manage those resources. And advocacy has also been done to political authorities and then to provide the necessary support that they require in responding to this. And you can also see a lot of discussion going on the need for Nigeria now to start producing vaccine in the country. So those are things that we can say capacity for responding and then controlling outbreak or preventing outbreaks in the country has been built.
Now, just recently, we had a number of people in Gombe State, died as a result of Lassa fever. So before we go, just give us an update on Nigeria's status as regards dealing with Lassa fever.
Well, the status, just like we said, capacity to deal in terms of laboratory capacity has improved and across states, especially in the Lassa fever endemic area. And then the treatment centers that were built for COVID-19 are also now being used for Lassa fever. So we have healthcare workers who are trained who can manage this in those states when they happen. Then surveillance has also improved in terms of reporting and detection of these diseases, and awareness among people has also gone up. And then, of course, with the commencement of the rainy season, we're going to be experiencing a downward trend in the cases of Lassa fever reported in the country. And of course, that means the outbreaks are related to rainy season.
Number of cases.
The numbers are now, the number is actually coming down, and I can't tell you the exact number right now, but I know that compared to about a month ago, we usually peak around February, March of every year. Of course, we have states that are endemic for Lassa fever, but those states also have capacity to manage those cases. So some states, they continue to report Lassa fever cases almost throughout the year. But the important thing is the case fatality from Lassa fever is also reducing because of experience gained in terms of case management. And then for people to report early is a challenge that we may be facing. And then, of course, healthcare workers' index of suspicion is also important, because the more the healthcare workers will suspect, the more they can detect early and then treat those patients. And also to protect themselves, because if healthcare workers do not suspect on time, and that means they themselves can become victims, because they are likely going to be careless in handling such cases.
All right. Well, thank you so much for your time on issues this moment. We appreciate you coming on the program and sharing with us what the NCDC is doing as regards Nigeria's fight against COVID and other related diseases. Thank you so much.
Thank you for having me.
All right. We've been speaking with Dr. Yahaya Disu, the head of communication, Nigeria Center for Disease Control. And with that, we've come to the end of the program for today. Connect with us via all our social media platforms, and also subscribe to our YouTube channel. You'll watch this from the beginning to the end in case you are just joining the show. My name is Ayuba Ilya. Thank you for watching. Bye for now.